was always good in science and math, and was trying to figure out a good career that would apply that. And I thought, what better career than medicine to help people? And when I was growing up, somebody I admired was my personal doctor, my pediatrician. He was a great guy, and I thought, hey, this guy makes people's lives better. What a great career. So that's how I started. I went to the University of Miami, undergrad, and then I had got my master's degree at Barry University in Miami as well. And when I was getting my master's degree, my classes were with the podiatry students. And prior to that, I didn't know much about podiatry, but since I was doing the classes with them, learned a lot more about the profession and decided to stay around and complete my medical degree in podiatry at Barry. I finished my degree in podiatry at Barry University in 1998 and did a 2-year surgical residency in Orlando from 1998 to 2000. In 2000, when I graduated, I started working at Orlando Orthopaedic Center, so I've been working here for 11 years. Well, I was born in New Jersey, but only lived there for about 7 years, and my father at that time got tired of the cold in the north, and he wanted to move south. So I basically grew up in South Florida, in Coral Springs, which is near Fort Lauderdale, and did my entire upbringing in that area until coming basically to Central Florida. Married, I have 2 children. They're 8 and 10 years old. Away from the office, obviously, with 2 small children, spent a lot of time with them. They're big sports fanatics. My son is 8, and currently he's playing football, but he plays baseball, basketball. My daughter plays tennis and softball. So a lot of games, a lot of time spent with them. What I like to do for myself, I like to work out a lot. I run. I've done some half marathons and some triathlons, and work out with weights. I like to stay in shape. I also like to play tennis. I play singles, and I also play mixed doubles with my wife. So all that pretty much occupies my time. Probably what I said before, why I went into medicine, is basically to help people. I mean, it's a great feeling if somebody comes to see you and they're in a lot of pain, and you're able to help them take away their pain. It's just a wonderful career to be able to do that and make a career out of it. From an ankle, I specialize in foot and ankle. And ankle is generally ankle sprains, injuries to the ankle, mainly sports injuries, and they're typically treated with some type of brace, usually elevation and ice when something is swollen, anti-inflammatory medication, and then a period of rehab. It's typical treatment for any type of injury to the ankle. As far as the foot, the most common thing I see is probably heel pain. What's called heel spur or heel spur syndrome, or even plantar fasciitis. That's probably the #1 thing I see in the foot. In addition to heel pain, some of the common things I see are everything from bunions and hammer toes and neuromas, which are typically podiatry things, to fractures of the ankle and fractures of the foot. So there's really a wide range of things I see. Somebody that spends a lot of time with them. What I've found with people that have come to me after seeing some of the other physicians in the community is they don't really spend a lot of time with them. They're in and out very quickly, and I don't think you can really make a good diagnosis and a treatment plan without really sitting with someone, spending some time with them. So that's what I try and do, really, to get not only to get to know my patient personally, spend a little time doing that, but obviously get really in depth with what's going on with them. I want them to walk away understanding what's wrong with them, and sometimes other physicians just write a prescription for something, and the patient walks out not even knowing what they have. I want my patients to know exactly what's wrong with them and how we're going to treat it.